How much more can they possibly take? Your gas costs more, your electricity costs more, your groceries cost more, your insurance costs more, your property taxes are climbing, and now Washington and Oregon taxpayers may be footing the bill for another major federal lawsuit, while many families are simultaneously staring down potentially massive health insurance increases. At some point, this stops being politics and starts becoming survival. Tonight we're looking at two stories that on the surface seem unrelated. One is a federal lawsuit against Washington and Oregon. The other is a battle over Obamacare subsidies. But both lead to the same place, your wallet.
From Seattle to Los Angeles, this is Left Coast News. No apologies, just the truth.
Welcome back to Left Coast News. Tonight we're going to connect some dots that most media outlets aren't connecting. One story involves the federal government suing Washington and Oregon over immigration enforcement. The other involves the expiration of Enhanced Affordable Care Act subsidies that have been keeping insurance premiums artificially lower for millions of Americans. Different topics, same taxpayer, same family budget, and the timing couldn't be worse because Washington residents are already dealing with some of the highest fuel costs, utility rates, housing costs, vehicle registration fees, and overall cost of living expenses in the country. Yet somehow Olympia keeps finding new ways to add pressure. Let's get into it. The DOJ sues Washington and Oregon. The Department of Justice has officially filed lawsuits against 4 states: Washington, Oregon, Massachusetts, and Maine. The issue: confidential license plates, specifically undercover and non-traceable license plates used by federal law enforcement officers. The DOJ says these states are refusing to provide the same confidential plates to federal immigration agents that they routinely provide to state and local law enforcement. According to federal attorneys, that creates a major problem. Federal agents conducting surveillance or executing arrests are being forced to operate with vehicles that can be publicly identified and tracked. The DOJ argues that exposes agents to harassment, interference, and potentially physical danger. Their legal argument is straightforward. They cite the Supremacy Clause of the U.S. Constitution. Federal law generally takes precedence over conflicting state regulations. The DOJ also argues these states are engaging in what they call intergovernmental discrimination. In plain English, if a state gives undercover plates to local police but refuses to provide them to federal officers simply because they don't like the agency involved, the federal government argues that's unconstitutional. Well, Washington and Oregon disagree. State officials say they are drawing a distinction between criminal investigations and civil immigration enforcement. They argue they shouldn't be required to use state resources to facilitate immigration operations. That's the legal fight. But let's talk about the money, because that's where taxpayers come in. So who pays for this? Here's the reality. Nobody in Olympia is pulling out a personal checkbook. Nobody in Salem is either. Taxpayers are funding both sides of this fight. Washington Attorney General Nick Brown's office will defend Washington. Oregon Attorney General Ellen Rosenblum's office will defend Oregon. Those lawyers are already on the public payroll, which means taxpayers are already paying the salaries. Now, supporters of the state's position will say the lawyers are already employed anyway. Fair enough. But that's only part of the story. Every hour spent fighting the federal government is an hour not spent on other legal work. Consumer protection cases, fraud investigations, criminal appeals, public records litigation. The resources aren't unlimited. There's also a much bigger risk. The DOJ is seeking legal costs. If the federal government wins and a judge awards fees, taxpayers could end up paying hundreds of thousands or potentially millions of dollars. Again, not politicians, not activists, not bureaucrats, taxpayers. The same taxpayers are already dealing with rising costs across the board. And here's the irony. Washington and Oregon leaders frequently talk about budget pressures. They tell residents there isn't enough money for roads, not enough money for public safety, not enough money for schools, not enough money for emergency preparedness. Yet somehow there's always money available for another courtroom battle. Whether you support the state's position or the federal government's position, one fact remains: this fight isn't free. Now comes the health insurance hit. While that lawsuit unfolds, another financial storm is building. This one could hit millions of Americans directly. Enhanced Affordable Care Act premium tax credits have expired after failing to gain Senate approval. For years, these subsidies significantly reduced monthly health insurance costs for many middle-income families. Those subsidies masked the true cost of insurance premiums. Now that cushion may be disappearing. Supporters of extending the credits warn that some households could see premiums double or even triple. Opponents argued the subsidies were hiding the real problem: healthcare costs themselves, insurance costs themselves, hospital costs themselves. Instead of addressing the underlying disease, they argued Washington was treating the symptom. Republican leadership pushed for stricter fraud protections and spending reforms before agreeing to an extension. Democrats pushed for a clean extension. Neither side got what it wanted. The clock ran out. And now Americans are left holding the bill, as usual. And if you think that's where the story ends, it gets worse, because at the exact same time Congress is fighting over Affordable Care Act subsidies, Washington state regulators are reviewing yet another round of health insurance rate increase requests. Just days ago, 13 health insurers filed requests to increase premiums by an average of 22.4% for 2027. Some companies are asking for even larger increases, approaching 25 to nearly 28%. More than 280,000 Washington residents who buy coverage on the individual market could be affected if those requests are approved. Now, here's the part most people don't realize. The insurance commissioner's office doesn't simply approve or deny rate requests based on whether they think consumers can afford them. Under Washington law, if an insurer can demonstrate that a rate increase is actuarially justified, regulators are generally required to approve it. In fact, the Office of the Insurance Commissioner has stated plainly, if we think the rate increase is justified, state law says we must approve it. Isn't that convenient? We've already seen this happen. Last year, insurers requested an average increase of 21.2% for 2026 coverage. After review, regulators approved an average increase of 21%, essentially confirming that nearly the entire requested increase was justified. Think about that for a moment. Washington residents just absorbed a 21% increase. Now insurers are back asking for another 22.4% increase. Whether the final number comes down slightly or not, the trend is impossible to ignore. Healthcare costs keep rising. Insurance premiums keep rising. Insurance company CEO pay keeps rising. Insurance company profits keep rising. And families are expected to somehow absorb the difference. So while politicians in Washington, D.C. argue over subsidies, and while Olympia fights expensive legal battles against the federal government, many working families are asking a much simpler question. How many more increases can we afford before something breaks? Why this matters in Washington. For many parts of the country, higher insurance premiums would be painful. In Washington, it's potentially devastating. Think about everything residents have already absorbed over the last several years. Record gasoline prices, rising utility bills, natural gas increases, property tax increases, vehicle tab costs, higher grocery prices, higher rent, higher mortgage costs, and now potentially higher insurance premiums. At some point, middle-class families run out of room. You can only stretch a paycheck so far. You can only absorb so many small increases before they become a major financial crisis. That's where many households already are. The average family isn't debating constitutional law. They're not debating federalism. They're not debating Senate procedure. They're asking one question: can we afford this? The bigger pattern. These stories reveal a larger issue. Government at every level continues making decisions that carry financial consequences for ordinary people. Sometimes those costs are direct. Sometimes they're hidden. Sometimes they're delayed. But eventually somebody pays. The federal government spends money it doesn't have. States fight expensive legal battles. Insurance costs continue rising. Utility costs continue rising. And working families become the shock absorbers for every policy failure. That is the pattern. Not just in Washington, not just in Oregon, across the country. The bill always seems to arrive in the mailbox of the people who had the least influence over the decision. The lawsuit over confidential license plates will likely take months, possibly years, to resolve. The health insurance debate is far from over, but one thing is already clear. Washington and Oregon residents are once again caught in the middle of a fight they didn't start and may ultimately be forced to pay for. And in a state where many families already feel financially exhausted, that's becoming a very hard sell. If you found value in today's report, make sure to subscribe and follow Left Coast News on YouTube, Rumble, Brighteon, BitChute, Spotify, Apple Podcasts, Facebook, X, True Social, Instagram, TikTok, and Patreon. Share this episode with friends and family and drop a comment below. How are rising costs affecting your household budget? And do you think taxpayers should be footing the bill for these legal battles? Your comments help drive future reporting and keep these conversations going. Thanks for watching.